you think it's possible that we won't see a serious reform and that this issue could just turn into a sort of political football used to...
Yeah, like it did in '93?
Yeah.
You know, when Russ Feingold said that up in Mercer the other day, I just about dropped my jaw. I mean, honestly, he basically is saying that he thinks it won't happen until at least Christmas or never. I don't see it. That's not the timeline that's going on through Congress right now. So I just don't see it the same way. So here's what's happening. More and more people are seeing what's in this bill. Seniors are starting to take note. The whole issue about rationing obviously, gets seniors legitimately worked up about it. These are the different Medicare cuts that are being used to help finance this bill. $171 billion from the Medicare Advantage program. 20% of seniors have Medicare Advantage plans. Those are going to go away or at least be dramatically changed. As more of these details unfold, the different tax increases to pay for it, I think the thing sort of collapses under its own weight from the support. But when we left at the last week of July, the votes were there to pass it. The whip counts, that's what we do. You literally count votes by asking people their opinions. More than half the Blue Dogs were in favor of the bill. So it could have passed, but it was delayed. The question is over the month of August, while people are listening to constituents, do they return back to Washington in September with the same position they had in July, given that people have had more of a chance to actually look at the contents of this bill? I mean, I got this bill, because I've already voted on it in committee. We got it at 11:57 p.m. the night before we started voting on it at 8:30 a.m. the next day. So, I mean, I'm a fast reader, but man, now that this thing's kind of hanging out there, I think it does beg the question. Here's the problem. Let's just assume the Blue Dogs hold tight, then it can be passed. The Speaker's saying she's bringing this up in September. It's basically this bill with public plan and all of those things in it. I don't think she cannot bring up a bill without it being just like this, because the majority of her party, who are on this bill that David was talking about, would revolt. So I think they're going to try and bring it up. It all comes down to this Blue Dog coalition. We don't have Blue Dogs here in Wisconsin. They're typically moderate Democrats in the South. Then it goes to the Senate. That's the big question. And the question in the Senate is around this rule called reconciliation. I know I'm talking kind of inside baseball stuff, but what reconciliation is, it's a procedural device reserved for budgets and budget bills. They're reserved for bills that are designed to reduce the deficit or debt. And the whole idea about it comes from the 1974 Budget Act, is that we will streamline budget-cutting bills to the floor, and they can't filibuster them in the Senate. It only takes 51 votes to pass it. It limits debate, so it greases these things through because it's politically tough to pass bills that reduce debt and deficit. That's the whole idea of it, and it's a good idea. But unfortunately, they kind of twisted the rules and applied that reconciliation rule to the health care bill. So if the Senate chooses to do so, they can bring this health care bill up through reconciliation. That means they don't even need 60 votes to pass a bill, which you normally need for any bill in the Senate. You only need 50 votes plus one. And Biden could break that tie. So when you have a 40-vote margin in the House, a 10-vote margin in the Senate, you have tremendous wiggle room with which to pass legislation. So clearly, the majority can pass bills, any bill they want to, with only their own votes, and they can even lose a number of votes. They have votes to spare. The question is, which I really don't know the answer to, is, are they going to lose too many votes and this thing fails? If this fails, then what happens? We would like to be involved in this process as Republicans. We're not. We've not been included in the process. And look, and I'm not saying Democrats bad, Republicans, unfortunately, Republicans do this to Democrats too when we're in the majority. So a lot of times when the majority power is in power, they just don't collaborate with the minority. They want to do it their way, jam it through. That's basically what's happening right now. And I think they're going to try and run this thing through, and we'll see. I really don't. I think it's going to come through in fall, and we'll see if the votes are there or not. I really don't know.